Thank you, Eva Medical Team, for the invite, and I indeed hope to share some interesting thoughts with you today. So my talk will be about the what and how of ACL injury prevention. And I actually want to start with showing a video of Viviane Minima, one of the star players from Arsenal. Leaving Arsenal, actually, I learned about and learn about her ACL injury mechanism. What we can see here is that it is important to not only look at what biomechanically happens. We all know the mechanism, landing with a straight knee, the foot placed out of the center of mass. But what we can also see that it's way more complex than that. There's an attacker approaching her. Thank you, Evert, for showing again. And Viviane needs to anticipate actually on what the attacker will be doing. She thinks the attacker is going to pass the ball to the right, but actually it's going to be on her left side, and she decides to change her direction, and that's when the ACL injury happens. So it's complex. Let's conclude that. So if we look at the current ACL injury prevention methods, we of course have the Viva 11 Plus. And I think it's great that this initiative has been launched a while ago with good exercises. But I think if we leave it to only these exercises, it's good for like basic strength and conditioning. But it's not really covering the real world context the players are facing. The exercises, and you can start the video, Evert, are pretty much pre-planned, closed. And the example that I'm showing you now is the example of an exercise, how to improve change of direction technique. But as you can see, this is kind of out of context. Of course, this as a basics, this may be important to do so. But I do not think, or I do think, let's state it this way, that we can help our athletes better. And basically not only training the perfect technique, but moving towards more a skill approach. What is the skill that they basically need? And that's broader than only practicing the perfect technique. Okay, next slide, please. Because what we're seeing also currently with the current Viva 11 program, it is poorly implemented, unfortunately. When we look at exercise 9, the plant and cut exercise, it's only only 10% of in this research of the people implemented it, and it's often also modified. A couple of barriers are that the exercises are experienced as being boring, not being sport specific, and not being challenging enough. So we need to look, I think, critically at what we are teaching them, and are we basically teaching them, is it good to teach them a perfect technique, or do we need to allow variation within the training programs? Because this is basically what happens in real life, repetition without repetition. And I think we need to allow variation within our injury prevention programs, basically, because then we are preparing them better for the real world. So is it good actually to practice a perfect movement form, or can we allow within the safe range, of course, some variation? And I think we can, because inherently there is always within a person, within person variation. So each time we perform a motor skill, it's not performed exactly the same way. And even when we look at between persons, there's also great variations actually, because every brain is different. So we move differently. So this also has consequences for the way we implement ACL injury prevention, and we need to allow some variation within and between persons. So we will accept this. This has consequences for the way we coach. So are we actually practicing the ideal movement technique, or do we allow some adaptable movement solutions? And I think we can. And we can allow some adaptable movement solutions and basically also practice variation within the exercises. So as you can see here, don't only practice, like I said, the pre-planned, closed, out of context skill of cutting, but for example, add a player, make the space a little smaller, let them react to colors, to already not only pay attention to what they do, but also pay attention to their environment. They need to pay attention to the other player in this case. So where is she in space? So that and where am I? And what do I need to do to perform my change of direction movement correctly? Another example on the next one is, for example, here with a simple rondo exercise where this player it needs to intercept the ball, of course, as an attacker, but she doesn't know where to go beforehand to integrate some unanticipated actions. So here again, just like within the ACL injury mechanism with Viviane Minimas, she needs to anticipate. And the last example, to allow some variation and don't only focus on the physical context, but also on the more neurocognitive context of ACL injury prevention, is shown here. There's an attacker and there's a defender, and the girl needs to chase another girl to be able to tag her. So she's cutting around the cone. Make it more challenging, make it more sport specific. There's a ball involved, there's attackers and defenders involved, and it's more fun. Also very important in my opinion. Tackling also the barrier of being boring. So we also need to look, that's the second part of my presentation, on how we are teaching athletes the motor skills. Currently, this is predominantly done with, so to say, explicit instructions. For example, to improve the alignment of the leg in the frontal plane, do not let your knee buckle inwards. For the sagittal plane, bend your hips, bend your knees to adopt the correct movement form. However, I think there's more, or there's better alternatives to this. And on the other side, we have the implicit motor learning, way of motor learning. And one example of doing so is to use analogy learning. For example, here in a defending action, the girl in red is defending. Just like with Viviane Minima, needs to anticipate on a fake movement, and to be able to, or to teach her to sit deep, so to say, while defending, to improve knee flexion, of course, and decrease joint loads. You can also tell her, instead of flex your knees or bend your knees, pretend you're going to land or to sit on a chair. This is, of course, a different way of teaching, but plenty of research has shown that this way of teaching leads to better retention and transfer over time. And these are two very important aspects in motor learning and also in ACL injury prevention. Yep, so on the left, explicit instructions, on the right, implicit instructions. And feedback. So, and why is it that implicit motor learning leads to better retention and transfer? Well, I always like this saying of Benjamin Franklin: tell me and I forget, teach me and I remember, involve me and I will learn. The thing is, with implicit motor learning, we are involving our athletes better. And that is because learning is a problem-solving process. And the more involvement athletes have in analyzing and reflecting on their own actions, the better the learning value. So that means, you can go to the next slide, Evert. Thank you. That we shouldn't too often give them the solution already of what we want to see, but we should stimulate self-regulation and discovery on how to solve that problem. So I always like this tweet of Neerith Rotem. Too often we jump in after the learner has done a few reps incorrectly or unsuccessfully, but we should let them practice and explore before interrupting and correcting. Think of the last time you learned a new task. It takes time and practice. And of course, it's appealing as a coach, as a physio, to correct an athlete when you do not see what you want to see. However, over the longer time, it's better to stay quiet a little, if possible, and let them figure out. Okay, my current trial was successful, not successful. How did it feel? What did I do? And how can I do better the next time? Of course, you need to be there as a coach, as a physio. Don't let it go wrong for too long and too much. But it's good to not overcoach because learning takes time. So the role as a coach may be reconsidered in this topic of motor learning to have to facilitate our athletes more instead of instructing them exactly what to do. So implicit motor learning is more facilitating. For example, I give the instruction when defending, pretend to sit on a chair instead of, and then with that implicit motor learning instruction, then the athlete has to think, okay, how am I going to sit on a chair? Well, of course, she is bending her knees, and there you go already. While with instructing more with explicit instructions, then you already give the solution, bend your knees, and we are telling the instruction then to the athlete, and the athlete is less involved in their own learning process, their own motor learning process. Next one. So you can also reconsider your role as a physio coach. So give the athlete time to process the intrinsic feedback. What does the player feel? Was it effective? How can I do better next time? Then your role as a coach or as a physio is to provide, also to help, of course, and provide feedback in the learning process. Like I said, it's good to not too often provide feedback, to have them discover themselves also. But then if you want to give feedback, there's two options. You can give them explicit feedback, like I said, the more traditional approach, or you can give them implicit feedback. Well, and the latter, like I said, leads to better retention and transfer, which is crucial for motor learning and thus for ACL injury prevention, because one of the items of injury prevention is to improve the quality of movement. So we've done some research on this, and one way to provide implicit feedback is to, for example, use video feedback. And you can use video feedback of athletes, of an expert athlete or a model athlete, or have athletes watching themselves. And of course, you do not control what the athlete is looking at. He or she can still look at the knees or other parts of the body, but with your verbal instructions, along with the video, you can instruct the athletes, try to mimic the entire movement of the model or of yourself, try to copy the movement, and don't pinpoint at specific parts of the body. So then there's other ways to implement implicit learning. And that's, for example, analogy learning or external focus instruction. So for example, here to improve knee abduction, and this should be a video, Evert. Yep, thank you. Also with cutting, you see again, it's a playful environment. You can instruct the athlete if she or he has a logo on the middle of her shirt to point the logo of the shirt towards the new running direction while cutting. Pretend your knee is the headlight, direct it to the new running direction. And this may all sound a little bit strange, but research really has shown that if you try to implement these kind of wordings, that athletes start to playfully play around with how to solve that problem. The logo of the shirt, move it to the new direction, move the headlight to the new direction to improve frontal plane alignment. And to improve sagittal plane alignment, You can also play this. Um, there's other instructions. Push yourself off of the ground as hard as possible has been shown in research to a lot to improve knee flexion. I want to see your cleats in the grass. Makes athletes also bend their knees to push off more forcefully. When making the cut accelerate like a rocket is also one frequently used. With all these analogy learning examples or external focus examples, you need to consider the age of your athlete, of course, which cue does work, which cue doesn't work, but it's definitely worthwhile to play around with this. Next one, please. So my take home is that it's time, I guess, to consider the what and how of ACL injury prevention to make sure the improved motor skills remain stable in the sport-specific context. Thank you.